Can I go to the pesticide issue and what breakthroughs we might be making in pesticides? Are there new pesticides that might be effective that can supersede the need to use DEET or other pesticides? Can any of you talk about that?
Thank you so much, Senator. First off, let's divide the different types of repellents and pesticides. So DEET is a product that we put on our skin. There are several FDA-approved products that are effective. I mentioned that there are some more products down the road which may be available in the future that may be more pleasant to use and just as safe and effective. There are also products that can be used in an area, what are referred to as spatial repellents, so things that you might burn in your household or spray in your household. There we're trying to get better products available. And then third are materials that we would use to control mosquitoes in a community, so insecticides or pesticides. One of the really interesting things that's happened in recent years is the refinement of ultra-low volume spraying, or ULV spraying. It uses tiny amounts of the pesticide and a very different particle size to penetrate more deeply, waft down more slowly, kill mosquitoes more effectively at a lower dose. And what we're seeing with those ultra-low volume applications is the ability to control mosquitoes with less pesticide but more efficacy. So one of the areas, again, is using our current tools more effectively, or tweaking them, if you will. The second is developing new tools, like new classes of insecticide. It has been decades since we've had a new class of insecticide available. That's why funding to develop new types of insecticides, ensure that they're safe and effective, is so important. That's why we're so excited about the chemical that Senator Gardner mentioned, newt-ketone, because it is non-toxic food grade. There are also new experimental methods, sterile mail or gene drive, that are truly experimental, where we might be able to crash mosquito populations. We'll have to see whether those are scalable, effective, and safe, but we won't know unless we study it.
Now, this ultra-low volume insecticide, have you used it in Puerto Rico?
That is currently under consideration.
And what would be the question that you would have to answer before its use?
The spread of Zika is so rapid and so extensive in Puerto Rico that it is likely that to have an impact, it would have to be applied by fixed-wing aircraft or aerial spraying. That creates a lot of concern in Puerto Rico, and there's been very vocal concern about that raised. We think there is a gap of information, and we're working hard to get valid information out and to confront some myths about this.
So the contention of the CDC or the U.S. government is that this ultra-low volume spraying can't be done without any danger to human beings, but yet play a good role in helping to control the Zika fly?
We believe it can rapidly reduce mosquitoes, and both CDC and the EPA have indicated that it can be done without risk to people, animals, or the environment.
And so down in Puerto Rico right now, you're saying that's being resisted because of a kind of just a generalized fear that something can be done that harms other children, I suppose, with those kinds of insecticides being put into the air.
There are a number of concerns, a number of historical factors, current events that make it a big challenge to do this there. But from a technical standpoint, we think this is the most likely way you could reduce the number of mosquitoes substantially and quickly.
Now, if an outbreak occurred within the continental United States, would this be one of the methods that you would recommend be used, let's say, in the first community that had an outbreak, in order to try to isolate it quickly?
It very much depends on the conditions in the community, but this is something that is done routinely in the U.S. In fact, the state of Florida each year uses ULV aerial application in about 6 million acres. It's done routinely in Tampa, Miami, and other places. It's unfamiliar in Puerto Rico, and therefore there are some concerns there.
Yep. And can I take just a little bit of time just to talk about the cost of now treating children who have contracted microcephaly or other diseases related to this epidemic. The United States is now going to have long-term responsibility for the care of these children. And it's going to add millions, if not billions of dollars over time to the budget of our country. And so this is, to me, a classic example of where working smarter, putting the preventative tools in place up front, will then protect us against huge balloon costs that could last 30, 40, 50, 60 years with something that we could have prevented from exploding into huge numbers. So even the children in Puerto Rico are Americans, and we have responsibility for them for years to come. So not spending the money there now is something that ultimately we're going to pay a price that's hundreds of times higher in the long term in terms of providing medical care for them. Could you talk a little bit about that?
Our Birth Defect Center has documented that the care of one child with a severe birth defect can be up to $10 million or more in their lifetime. So there is a personal tragedy, a family tragedy, but also an economic cost for not preventing preventable cases of birth defects. It's very rare to have birth defects that can be prevented in the dozens, hundreds, or thousands. Yeah. Our staff from our Birth Defects Center tell us that in the 30 years they've been working on birth defects, this is the most urgent situation they have faced.
Yeah, so, you know, the old saying is a stitch in time saves 9, but here $1 billion now could save $10 billion later because of all the children who would not ultimately be born with this disease that we would have a moral responsibility, a legal responsibility to take care of. So I think that's something that we should all think about in terms of Puerto Rico or any of the other places that could ultimately be affected by this disease, even if it's not something that happened inside the continental United States. Thank you, Mr. Chairman.